Oh, they don't have
So
any.
that way.
My pen, please. I'll stay for 4 after.
Oh my God. If you need someone.
Okay, so what's today's date? Today's February 17th. It's a Thursday, right?
You gonna do it?
We're gonna talk about dementia.
Yes, hard. You want some desperate.
So what? It's like, we'll see, we'll see.
Dementia versus delirium.
No, hold on. I need to talk to my cousin first.
You gotta talk to your cousin. Who's your cousin? Who is your cousin?
My cousin. That's because I'm supposed to see her later. That's why.
Oh, okay. All right. Okay. So somebody tell me what dementia is and what do you know about dementia?
It says intoxication.
Don't look at YouTube or you can Google. Tell me what you know about dementia.
It's acute illness. That's what I know.
That's what dementia is, an acute illness?
Delirium,
Oh,
delirium.
Okay, we're not delirium
It's
yet.
acute.
We're talking about dementia. Tell me about dementia. What is dementia?
Dementia is like you forget.
Loss of memory.
Loss of memory, right? Loss of mutation, maybe.
It's plaques in the brain.
Plaques in the brain. Okay. These are good answers. Okay. So dementia is an umbrella term, right? And underneath dementia, you can have different types of diagnoses. You can have Alzheimer's. You can have Parkinsons. You can have dementia with Lewy body. You can have vascular dementia. Okay. But these are basically progressive diseases that affect your brain, right? Depending on where the plaquing, like as I mentioned, depending on where the plaquing is inside your brain, is going to determine what kind of diagnosis you have. Okay, like for example, Alzheimer's. You guys want to turn your radio off?
Cordiness.
Alzheimer's is different than Parkinson's. Okay, in a way that it plaques your brain, the location of it in your brain, right? So let's go back real quick. So if you're looking at dementia, and underneath, we're saying that dementia is a progressive type of disease and it's irreversible. There's no cure for it. It gets worse year by year, right? On the other side of that, you have delirium, where it's something acute. For example, somebody gets an infection. You know, you're confused. You have delirium.
Yeah, there you go.
That is a change of mutation that could be reversed after taking medication, right? If you get rid of the infection that's causing the confusion, it's reversible, it's treatable. It could be, a week later, it could be a month later, or maybe it could be a year later, but it's something that you work on it and then you try to treat and you can reverse it. Okay, and it could be related to dehydration, right? If you could have an imbalance of electrolytes, that will cause you to have certain type of delirium. Okay, it could be like a pneumonia, or maybe you have too much drugs that was given to you because you went to the hospital. You broke your hip, you have a UTI, now they give you narcotics, now they give you Ativan for anxiety, and now you're going to be more delirious. So the main difference between dementia really is that dementia is a progressive disease and it's irreversible, where delirium is something that's acute and you could potentially, cure it a little later, if you get back to baseline. All right, so let's talk a little bit about dementia and what falls underneath that umbrella term, okay? And the main one is going to be Alzheimer's, okay? Because a lot of patients over 65 that you're dealing with that have dementia is more than likely 60% of the time is going to have Alzheimer's, okay? And this is the most common type of dementia. It affects predominantly your cognition, okay? Cognition, and over time it affects your motor, so your motor skills, meaning that over time you're going to get worse. And it's going to affect the way you swallow, the way you walk, That's why when somebody has dementia, our main focal point for treatment is going to be symptom management. For example, if somebody has dementia and they're getting worse, their behavior, we're going to try to treat that behavior. A lot of times the patient with dementia who starts to decline, it's 10 years now and it's getting worse. They're going to have issue with swallowing, they end up having aspiration, they end up having pneumonia. And it's usually that type of diagnosis that the patient expired from. It's the fact that they're declining and they can't eat, they can't drink anymore. Okay. The other side of that is Parkinson's. Who's familiar with Parkinson's? It's a type of dementia.
That's where they shake a lot.
Shake and bake. Yeah. So you have that. Yeah. Right. It's you have a lot of like shaking, a lot of tremors,
Right.
and so Parkinson's is predominantly a motor issue, okay? And over time though, it affects your mentation, your cognitive. Okay, but when we're talking about Parkinson's, you're thinking of somebody who has tremors and is predominantly a motor disease. Okay, and it affects the way you communicate, the way you walk. You have that shuffling gait, you have the shaking. But like I said, over time, as the disease gets worse, you're gonna have some cognition issue. Okay. Now, what about dementia with Lewy body? Okay, it's with Lewy body. Dementia with Lewy body. Dementia with Lewy body is like it's the same as like Parkinson's, except this one affects your cognition more frequently. So it's kind of like Alzheimer's, but this one will have simultaneous symptoms. You'll have both motor and cognition affected. Okay, so you might see somebody who's got like shaking and tremors, right? They have Parkinson's, but they also have mentation issue, cognition issue. So that would be Lewy body, dementia with Lewy body, because likely it's affecting their motor, not only their motor, but also their ability to think and make, decision. Okay, so it affects not only cognition, but also your motor function. Okay, so when somebody says motor, is usually just think of like the car, and it's like moving and walking or whatever. And so dementia, when it affects your motor, your ability to walk around and eat and swallow. Okay, cognition means mentation, obviously, the way you make decisions. Okay.
So it affects both at the same time?
It affects both at the same times, or you might have cognition, loss of cognition, affection of cognition, and then shortly after that you'll have some motor issue. Okay, where Parkinson's is predominantly a motor issue, and then over time, 5 to 10 years later, you might have issue with cognition. Okay, all right. And you're late, sir, so you're only gonna get half a point.
See you next week then.
Come on. This is
So the other part of dementia, guys, is gonna be
What is Alzheimer more worse than dementia?
so if you look at dementia, Alzheimer is dementia is an umbrella term.
Okay.
Okay, so when somebody says I have dementia, then we have to try to figure out what kind of dementia you have
How about Alzheimer? Like
It falls under.
underneath the dementia. Okay, it's not that. So a lot of times the doctors will diagnose a patient with dementia just because they might not pinpoint like what the actual diagnosis is. It's just easier to say, oh, he's got dementia. But if we're looking at this in a nursing perspective, what kind of dementia do you have? Okay, because you can also have vascular dementia, which means that vascular, what does vascular mean, right? What does that mean? What does vascular means to you? Circulation, right? So meaning that if somebody had a stroke or something like that, somebody had a stroke, you have a decrease in circulation in your brain, you have now ischemic tissue that's in your brain. So this type of dementia is called vascular because you have a decreased circulation. And it's not something that's progressive where it gets worse over time. It's something that's gradual, like you have a steep drop in loss of memory, loss of motor issue. So vascular dementia has got to do with something in your brain that's either circulation, diabetes, hypertension, trauma to your head. As a boxer, a lot of you see these boxers that have issue and they might have vascular dementia at the very end of their career, right? And it has all to do with trauma and issue, ischemic issue in their brain. Okay, and then you also have like frontal dementia, front of your brain, basically specific to the area in the front of your brain. You have, plaquing predominantly at the very front of your brain. And it's got the same symptoms, but it's another diagnosis, okay? Okay, so let's jump over to delirium and what causes delirium. So, I'm sorry, let's go back real quick to our nursing intervention for people who have dementia. How do we communicate with people who have dementia? What's the best way to approach these residents? Somebody who's sundowning, right? Think of sundowning. What's sundowning?
eye to eye. You gotta talk to them eye to eye.
They can get aggravated.
They can be aggravated. Sundowning. What else is sundowning that you think of? They have more confusion, right? At a specific time. What's
Changing of the time.
Yeah.
between 5 to
There you go.
7 o'clock.
Yeah.
Go
Right,
there.
right, in the afternoon, right?
In the
A lot of your,
afternoon.
Usually
a lot of your patients in the afternoon will get more confused,
Oh,
right? It's sundown,
yeah.
right? Like when the sun comes down, you know, the wolf will come out or something like that, but,
Behavior.
but you get more confused, right? Like when.
Confusion, yeah.
Right.
She was blinding me with her
So,
cell phone.
Yeah, you get more confused with the in the afternoon. So what are some of the what are some of the treatment that we provide, or what's some of the care that we can provide for these residents that have sundowning or more?
You need
Music?
to
Music
calm
is
your,
very
also
important.
calm your voice when you talk to them.
Yeah.
Calm your voice,
Lower
right?
your voice.
Eye to eye.
Approach them from the front, not the rear.
Okay.
Let them
Yeah.
see you.
Okay.
Offer
All
them
right.
a warm glass of milk.
A warm glass of milk. What's that for?
Oh,
that's
What?
nice.
It makes you
So
tired.
that makes you fall asleep, right? Yeah. So yeah. Well,
Add honey to it.
we give that to her. Yeah, we give that to our kids at night too, right?
Well, just need a sleeping
Warm milk.
pill.
Yeah. So.
How about sleeping pill?
Patient, so what's the best, it's called patient-centered care, right? Patient-centered, who's familiar with patient-centered care? This guy over here who deals with Alzheimer's patients all the time, right? You know what that means, right?
So what you do?
Patient-centered care?
Yeah, patient-centered care.
What do you do?
Somebody-
I'm sorry.
Patient-centered care. What do we do? What kind of care is that?
What is it?
What does that mean?
Well, I'm
Yeah, I have no idea.
I'm drawing a blank.
Okay, okay. So patient-centered care means that you wanna meet the patient where they're at, okay? For example, the patient is aggravated and they're walking a certain location.
Yeah, neither have I.
You don't wanna just all of a sudden come up to the patient and say, hey, sir, let's come over this way, and then he's like, you guys are arguing, right? And he's like, no, I'm gonna go this way, and you're like, no, let's go this way. You wanna, you wanna meet him where he's at, basically provide the care that he needs, and then later on, you know, if he doesn't wanna go where you want him to go, maybe you wanna try again later, you know, or maybe redirect
Oh,
him,
just like
changing.
Jack. Sometimes he
situation.
does that.
Yeah.
What did she say?
So what is the best
Like
way
if
to
you
redirect?
tell you something,
So what-
you need to listen to him, or else it's
Oh,
gonna.
you said Jack does that.
Jack.
Jack.
Yeah,
Jack.
so what do you do? What do you do for him?
Oh,
Just leave him
Jack.
alone.
Just leave him alone, yeah, otherwise, what are you gonna get? You're gonna get somebody
Oh my
who's
God,
gonna be
you
more
gotta
pissed off,
realize-
right? Yeah. So just kind of monitor him and then come back later on and then redirect him, maybe change the subject or offer him something, you know, but there's, you know, that's what patient-centered care means, I mean, meeting the patient where they're at. But music, somebody mentioned music, that's important. Because people with dementia have short-term memory issue, right? But do they remember things from in the past?
Oh, yeah.
Yeah, they don't lose that long-term memory,
Oh, no.
you know, they still have it, so,
They still have it.
so music is very important.
Reminiscing, it's like reminiscing with them, like tell them about their childhood or.
Right. And what is music, what is music, we associate that with time, right? If you, for example, if you were going out with somebody and you had to play some music or whatever, you might remember that person, right? It's the same thing with residents, you know what I mean? Like, these music brings them back, way back, you know, when you play the right music,
Reminiscing.
and, you know, on the other side of that, you play the wrong music, and you might freak them out. So, that's why I play a calming music, right? Okay, let's talk about delirium. What's delirium? Remember I said what delirium is?
Like an infection.
It's acute.
It's something more acute, right? Yeah,
That's what I know about it.
that's what you learn in Google, right? So, yeah.
That's what I see.
Yeah. So if somebody who has like dementia and is all of a sudden having aggressive behavior,
Or new
something out of
medication, new medication.
a new medication, yeah, you might have a change of medication because of that. Let's just say somebody has dementia, right? That has Alzheimer's. It's more aggressive now, right? And maybe they're more confused or something. But there's definitely a change in baseline, right? You're trying to figure out what's wrong with them. What would you think is wrong with this patient? Why are they more aggressive? Is this related to dementia maybe, that's getting worse? And
No, they might be in pain, or maybe they have some like health issues.
Some health
But
issues?
they can't communicate with us.
yeah, it could be something acute, right? If
Yeah.
something is acute that's messed up with it,
Yeah.
maybe it's an infection, it's more than
They
likely.
get aggressive.
it's more than likely somebody, well, this resident has some acute infection or some acute pain that they're
Yeah.
experiencing. And what do we call that delirium, right? And you can have dementia and
UTI.
delirium on top of
Yeah,
that.
yeah.
Okay, so delirium, you're gonna say, oh man, this patient who's got dementia is more aggressive, he's got even worse dementia. That's like, no. Okay, it's likely that they have a change in condition, they're more aggressive. It's probably because maybe they're constipated, they're in pain. You know, they can't communicate with you verbally what their needs are, so maybe they also have like, you know, you wanna do some kind of lab, you wanna check their UA, maybe they have an infection, you know, pneumonia, they're having shortness of breath. Hypoxia can cause delirium, right? That means you have a decrease in oxygen and you can't think correctly. And so because you can't communicate your needs, you're gonna be more aggressive, you're gonna be more restless. Okay, so always look for that. When somebody has a change in baseline, don't all of a sudden think that it's just dementia. It could be delirium. It could be something acute. There's something happening to this patient. You could have an infection. Okay, you could be dehydrated. Dehydrated means that you have low fluids. When you have low fluids, all your electrolytes are spiked up. It means your sodium is high, your potassium is high, you know, your calcium is high. When all those are high, you're gonna have issues with your behavior. Okay, especially if you're already confused, right? So definitely always think outside the box. But just because somebody is diagnosed with dementia doesn't mean that hey, they have more aggressive behavior. Let's just give them some Ativan. Try to figure out what's wrong with them. I know, you know, our current situation with our license and stuff like that doesn't allow us to do that. But hey, definitely say to your nurse, I mean, yeah, you know, he's more aggressive. I think we should probably do some labs. He even has these kind of vitals. Just take a look at these vitals that they're exhibiting, right? You could have dementia, Alzheimer's, and all of a sudden they have a low-grade fever. They have a pulse that's high, they have a blood pressure that's low. What does that tell you? Okay, it tells me that maybe a systemic reaction to something like a fever is more systemic. That means that your body's reacting to some kind of infection, right? A high pulse rate is going to tell you that you're probably dehydrated or some sort, right? Or your potassium is high, that's why your heart rate is changing, right? But your vital sends you a significant message, basically. You know, if it's off the baseline, it's telling you something. So it's always important to get these vitals. Thinking outside the box is really important. All right. Any questions on delirium versus dementia? We're pretty comfortable with that, right?
So a person can be confused when they're delirious too, right?
Yeah. So you could have a diagnosis that's irreversible, that's already long term, that you can't cure. That's called dementia, right? Let's say Alzheimer's. If you get over medicated with narcotics or maybe Ativan, you're gonna have more confusion, and it has nothing to do with your dementia. It all has to do with pseudo dementia, which is more or less like a delirium related to this medication.
Yeah.
So if you take away that medication that you were taking, that you were over medicated with, you go to baseline and get you
What about
confusion before, right?
I see.
So yeah, so definitely you can have Alzheimer's and then have delirium on top of it, and you're just gonna be more confused, more agitated.
Even more confused.
Yeah. So knowing the baseline on anybody is important. That's why we always talk about orientation, right? You can be oriented times 2 or 3, and then now you're oriented times 1 or 0, and you have more confusion because of the fact that you might have some acute infection, acute discomfort, acute pain, right? Dehydration. You know, maybe your potassium is high. You know, maybe your blood sugar is high. Even your blood sugar is high, because you know what? Agitation, this behavior. When somebody has acute delirium, you can have hypoactive reaction or hyperactive, meaning, and you see it all the time. I'll give you an example, okay? When somebody who has an infection is 65 and above, they're gonna be more confused and more hyperactive, and they're gonna fall down, or they're gonna be somnolent and very tired and lethargic, and blood pressure is low, right? You see that all the time, and that's the two symptoms that they'll exhibit. Delirium, you can have hypoactive or hyperactive reaction. Okay, so knowing those two things is really important. And knowing that people has Alzheimer's is great, but knowing that somebody has Alzheimer's and delirium on top of it because of an acute infection is even better. Okay, or somebody showing signs and symptoms of dehydration, now they have acute delirium because of that is even better, right? Because now we can treat that delirium, and then we can deal with Alzheimer's, Alzheimer's later, right? We deal with that every day anyway, you know? Everybody answers the questions in here. Mary, do you want to add something?
No, I'm just listening to your wisdom, to your
The
personal
wisdom? Yeah. Okay, let's go ahead and answer these questions. Do you have any questions about anything as far as,
No, I don't think so.
no? Let's go over what makes delirium different than dementia. Question number one, what makes delirium different than dementia?
Dementia is progressive and irreversible
Yep. Okay, and then delirium is more acute, and
and
that's
treatable.
untreatable. Okay, true or false, someone who has dementia can also acquire delirium?
True.
It's true. Delirium, question number three, delirium is abrupt, whereas dementia is progressive.
True.
Okay. Parkinson's predominantly affects cognitions more so than motor function.
False.
That's false. Remember, Parkinson's is predominantly a motor issue, right? And then later on, you might have some form of cognition. All right, dementia with Lewy body affects both cognition and motor function.
True.
Symptoms occurring simultaneously. That's true. And then six, someone who has dementia may have difficulty swallowing.
True.
True. And then delirium and dementia are diseases that can be reversed or cured.
False.
That's false. What is the focus and treatment for dementia?
Medicine?
No, so the focus and treatment for dementia, remember, it's symptom management. There's nothing you can do to treat dementia, but you can slow it down with medication. But a lot of our treatment is focused on symptom management, aggressive behavior, right? Redirect them. Swallowing issue, right? Monitoring them for aspiration, precaution.
Symptoms, managing them.
Symptom management. We're just doing symptom management, guys. It's like a disease that you can't cure, right? We know it's gonna get worse. We're just gonna go with the flow and try to provide the best care that we can for these residents, so they don't get the infection, aspiration that that they're at high risk for. Okay. What is the best way to redirect wandering patient who is suffering from sundowning?
Music, eye to eye,
Reminiscence.
Okay, there you go.
Leave them
That
alone.
patient-centered care type of thing, right?
leave them alone.
Leave them alone, monitor them, actually.
Oh, yeah.
Okay, 10, true or false, the last one, a sudden increase in dementia, anxiety, or delirium can be a sign of aggression.
True.
No,
False.
it's not a sign of aggression. If somebody has an acute infection or acute changes or has some kind of delirium that we're dealing with, it could be an acute infection that we're dealing with.
Symptom
Okay, yeah, it's false.
Oh my god, I read it too fast. This is a trick question.
Okay.
That's what always happens, you gotta read every word of that question, Missy.
Yeah. All right, guys. Any questions on dementia and delirium? We're now
You guys get it? We're experts.
Yeah.
we're expert now, right? Make sure you sign this to get your CEUs.
10 is false.
Wait, did I sign that one?
10 is false.
Oh no, that's I'm sorry.
You got the right one?
Yeah, you guys sign this right here, please.
Do
Dementia.
I still need to come see you, John? Cause I forgot to see you too.
Oh yeah. We're gonna do it right here. It's just like 5 minutes.
My last one.
Oh, yeah, tell me where you got those again?
Oh, yeah, in Pro Finish in the Mesa.
Oh, what? Pro finish? Yeah, pro finish. How much
In service? Yes. Oh, we can do a